How to get health insurance approved for Zepbound. Obtaining a weight loss medication such as Zepbound through your health insurance can be a meticulous process requiring several coordinated steps. Here's a comprehensive approach to ensure that you can efficiently use your health insurance benefits to cover Zepbound Rx for your long-term weight management. Step 1. Consult your healthcare provider. Your journey begins with a consultation with your healthcare provider. It is essential to discuss your medical condition and the potential benefits Zepbound might offer you. Losing weight not only improves underlying medical conditions but also prevents future ones from developing. 1. Schedule an appointment. Make an appointment with a physician who focuses or specializes in weight loss. Detail any symptoms, treatment history, and your motivations for considering Zepbound. 2. Medical assessment. During the consultation, the doctor will evaluate your medical history, current health status, and previous treatments. They will determine if Zepbound is a suitable medication for your condition, which weighing the risks and benefits based on your personal and family history or genetics. 3. Get a prescription. If the doctor decides that Zepbound is appropriate for your treatment, they will write a prescription and send to your preferred pharmacy. The provider will ensure the prescription includes all necessary details such as diagnosis, dosage, frequency, and any other special instructions necessary for the pharmacists to run it through to your insurance plan. Step 2. Verify coverage. Before you can fill your prescription, it's crucial to verify that Zepbound is covered under your insurance plan. 1. Understanding your health insurance plan. Start by reviewing your health insurance policy documents or your insurer's online portal to understand which medications are covered under your plan. Pay attention to the formulary, the list of covered drugs, and any tiers they might be categorized into. 2. Contacting your insurance provider. You can also simply call the customer service number on the back of your insurance card. Prepare to provide your policy number and personal information for the agent to verify who you are. Inquire specifically about Zepbound. Is it covered under your plan? Is it included in the formulary? Is prior authorization required? What will your out-of-pocket costs be, including copayments, coinsurance, and any deductibles? 3. Understanding prior authorization. Many specialty medications require prior authorization. This means your insurance company needs to approve the medication before they agree to cover its cost. Understand what the prior authorization process entails and what documentation is needed. Step 3. Obtain prior authorization. Prior authorization can seem daunting, but it's a standard procedure to ensure that medications are used appropriately. 1. Initiating prior authorization. Your doctor's office will usually initiate the prior authorization process. Sometimes, this can also be initiated by the pharmacy. They will provide the insurance company with your medical records, treatment history, and the rationale for prescribing Zepbound. 2. Required documentation. Collect all necessary documentation that supports your need for Zepbound, and make sure your provider has this on hand before initiating the prior authorization process. This may include diagnostic test results like blood work, imaging, pathology reports, etc., previous treatment records and outcomes. Example includes your participation in programs such as Weight Watchers. Detailed clinical notes from your doctor explaining why Zepbound is the most suitable option for you. 3. Approval timeline. Understand that the prior authorization process can take anywhere from a few days to several weeks. Stay in regular contact with your doctor's office and your insurance plan to monitor the status of your authorization request. Step 4. Fill the prescription. Once prior authorization has been approved, you will get notified by your doctor's office or your health plan by email or text message. You can move forward with filling your prescription. 1. Choosing a pharmacy. Select a pharmacy that is within your insurance network. Many insurance plans specify certain pharmacies for filling specialty medications. 2. Provide prescription and insurance details. Give the pharmacy your prescription and insurance information. The pharmacy will process your prescription through your insurance. They may also handle any necessary paperwork regarding prior authorization. 3. Understand your costs. Be prepared to cover any out-of-pocket costs. This can include copayments, coinsurance, or deductibles. The pharmacist can provide you with details about what you will owe at the point of sale. Step 5. Follow up and troubleshoot issues. Sometimes issues arise with insurance approval or medication coverage. Here's how to handle them. 1. Addressing denials. If your insurance denies coverage for Zepbound, find out why the denial occurred. Common reasons include missing information or questions about medical necessity. This occurs if proper documentation was not provided or submitted during the prior authorization application. 2. Appeal the decision. If denied, you have the right to appeal. Work with your healthcare provider to gather additional documentation that supports the necessity of Zepbound for your treatment. Submit a written appeal to your insurance company, including a letter from your healthcare provider detailing why Zepbound is necessary for your medical condition. 3. Communication with insurer. Keep detailed records of all communications with your insurance company, including dates, times, and the names of representatives you spoke with. This can be crucial if you need to escalate your appeal. Step 6. Explore assistance programs. If you encounter financial obstacles even with insurance coverage, there are additional resources that may help. 1. Manufacturer assistance programs. Many pharmaceutical companies offer patient assistance programs to help reduce the cost of their medications. Check if the manufacturer of Zepbound provides such a program. These programs often offer significant discounts to eligible patients. 2. Non-profit organizations. Look for non-profit organizations that provide grants or financial assistance to patients needing specialty medications. Organizations like the Patient Advocate Foundation and NeedaMeds can be valuable resources. 3. Pharmacy discount cards. Some pharmacies offer discount cards that can lower the price of medications. While these discounts do not typically combine with insurance, they may provide an alternative.